Hi, I'm Dr. Mike Milligan. We have a real treat for you here. I've got Ashley Truitt, the Director of
Dental Sleep Medicine
for
Modern Dental Laboratory.
Laboratory. She's from Australia. Ashley, thank you so much for being with us.
Great to meet you, Mike.
Okay, great. So Ashley, we're here at the Shine Sleep Complete course at PGA National Resort in Florida. And part of that is modern dental labs. Now, it's a huge lab.
It's one of the world's biggest laboratories, absolutely. They have around 3,000 technicians, which is amazing, and they have the platform to have all of the ISO certification, good manufacturing processes. It's a well-oiled machine. It's fantastic.
Wonderful, with many offices. Chicago, Seattle is their home, and
Seattle's their corporate office, Seattle, Chicago, LA, and Boston.
Okay, so where Modern Dental Labs fits in this is they make the Moses appliance for sleep apnea. So now your background is in orthodontics and then airway.
Orthopedics, orthodontics, functional development, which led me to get involved in dental sleep medicine, primarily airway, absolutely.
All related. And so, hooked up with Dr. Moses, who developed the Moses appliance. He's in the Sears Tower,
in
now
Chicago.
Called a different tower.
Willis
Tower in Chicago.
Yeah.
And that's where his practice is. And so they've got the Moses appliance. You want to tell us a little bit about it?
Absolutely. The fantastic thing with the Moses appliance, I mean, these appliances work primarily like the chin lift. They're holding the lower jaw forward, which opens up the airway in the evening. So these are a great alternative to CPAP therapy. Where CPAP's very effective, a lot of patients can't wear the mask on the face.
Right.
So with this appliance, you've got the hardware on the side, which sort of fits in the cheek area, and what that allows then is all of this tongue space. The tongue is the beast, as Dr. Tucker likes to call it. It's the main offender. The tongue will drop back and block the airway, and that's when the apneic events happen in snoring. So this appliance actually guides the tongue up out of the airway, and you can see here this little anterior opening here. That's where the tongue just sits nicely up and out of the airway. And the patients just wear this at night. It's very comfortable. It's easy to wear. They take it out in the morning, and that's the therapy. So, and then the patients often feel so much better then, you know, so they're more prone to wanting to eat better or exercise, and overall, for overall health, it's terrific. It's a great form of therapy.
It's a very reasonable price, lab cost to this?
The lab cost for the doctor is $329.
Right. Okay.
Which is very reasonable. Most medical insurance covers the therapy, and it's all billed under medical insurance, not dental.
Everything's medical.
Medical.
You take upper and lower impression and a bite registration, and it's a little different.
Correct.
It's not the George Gauge. It's a different bite registration that Dr. Moses developed.
He did. He invented this specifically to get the optimum position for this appliance, which is very important. So they're called the Moses bite shims.
Right, and so, and we've had several testimonials here of reputable people about using this appliance as opposed to any of the other ones. And I think some of the main things that I heard in the course here were the space for the tongue.
The tongue.
Huge.
That's it.
Yeah, that's the main thing.
It's the main.
And then the other thing is that the patient, they're not locked in. The jaws aren't locked together.
Right, absolutely. And what that allows is there's no hardware or anything in the oral cavity. There's nothing in the palate, and that's where you want the tongue to sit. So a lot of appliances have hardware or mechanisms in the oral cavity, and that restricts it. It makes the tongue go backwards, and we want the tongue forward, out of the airway.
You do have a couple of other devices here.
Yes.
The EMA appliance.
The elastic mandibular advancement appliance. This is actually a great little appliance, and they are a little bit different. Both of them have a lot of tongue space, which is terrific, but the major difference here is you've got a little bit more give. So if you have a patient with compromised joints, or someone with very tight muscles or little mouth that doesn't have the vertical, this appliance would be the appliance of choice. It's a very comfortable appliance, not quite as robust
Right. This is the number one. This is the go-to appliance for the vast
it's more
majority
robust.
of people.
And then, yes, I mean, this is still, they're both FDA cleared for the treatment of snoring and sleep apnea. It's a great little appliance. It's about giving your patients options and alternatives.
Right. And then you do have the temporary appliance.
This
as well.
this is actually a great invention. Dr. Don France, he invented the EMA product suite from Houston, Texas.
Okay.
And there's a place for a temporary or a trial appliance. Maybe a patient is undergoing dental treatment and they need something right away.
Right.
This actually is something that the patient can walk away with the same day. You can make this in your office. It'll last about 90 days.
Okay.
And then all while their custom appliance is being made, it's a great option to deliver a trial appliance.
Great. Ashley, can you tell us a little bit about the research involved here?
Absolutely, Dr. Milligan. Of recently or lately, some research has been released or published that they did a trial in Australia, actually, comparing CPAP to oral appliance therapy, and basically it put oral appliance therapy and CPAP on the same footing, not just for mild to moderate, but also for severe patients. So the American Academy of Sleep Medicine released or published the guidelines in 2006 saying primary treatment for snoring and mild to moderate sleep apnea are oral appliances, and prior to that CPAP has been the gold standard for everything, for mild to moderate, snoring, severe. So now oral appliances, it's been proven in empirical research studies that oral appliances are great or on the same footing as CPAP.
Now that wasn't in 2006, was it? Or was it?
This research this year. In 2011.
2011. This
yes,
research came out showing that it's just as good as CPAP.
Correct.
For
moderate to severe patients.
Moderate to severe.
Yes.
Wow. Okay.
Mostly because patients will tolerate the oral appliances where they're not necessarily going to tolerate the CPAP.
Right. And then also, even in severe, certainly for mild to moderate, this is, for years has been, for the last 5-6 years, has been considered a great option.
Mm.
Also then in severe, a lot of times a combination therapy. If by using an oral appliance, they're able to have a lower pressure on their CPAP.
Great point, absolutely. Right. And that's one of the things that patients who cannot tolerate CPAP, sometimes the pressure's so high that it's very uncomfortable to wear. But by doing the combination therapy, they can wear both and lower the pressure of the CPAP, which is a lot more tolerable and comfortable, and the patient's getting great treatment then. Great.
Is there any last thing you'd like to say, Ashley, before we close?
No, just the whole concept of dental sleep medicine and total health, which is the program that Shine's putting together. I can't stress enough how important and how wonderful that is for the dental practice to be so involved with overall health. And sleep medicine is something that's so fundamentally a problem in our community around the world right now.
Wonderful service. Now there's a huge need for dentists to become involved with the oral appliance.
Absolutely.
Treatment is either CPAP, oral appliance, or surgery.
Mm-hmm.
And more, the oral appliance is becoming a treatment of choice for many patients, even though CPAP is the gold standard. And then Shine Sleep Complete has put the program together with Modern Dental Lab, with the Moses appliance and the EMA, with Dental Writer.
For the documentation and insurance, medical billing.
And communication between the physicians and that type
so
of thing.
Important.
And then also the third component of that is the
diagnostics.
WatchPat, the home sleep study WatchPat by Itamar. And then the education with Dr. John Tucker, who you alluded to.
Right, which is, it really is Sleep Complete.
Nice
it's complete.
Ashley, thank you so much.
Thank you so much. Great chatting with you.